In this video, I want to talk about what chiropractors do that can help you with low back pain. So when we look at the lower back, there's different aspects to the lower back that really make it important. We've talked a little bit about this before, but we look first and foremost at the alignment, which is the levelness of the pelvis. Ideally, we want this nice and straight here, okay? And there's different reasons why that gets thrown off. It can be due to one leg is longer than the other. It can be due to scoliosis in the lower back, which is instead of the spine being straight, there's a curve to one side. It can happen because the feet are collapsing on one side. I mean, there's different reasons. There's more reasons than just that. But that's the first thing that needs to be clarified, especially if you're having chronic low back pain. If you're having a low back pain episode, sometimes it's just as simple as that positioning of the pelvis has become unlevel and we need to reestablish the stability and the support in the lower back. The next aspect is what we call the spinal architecture, or the shape of the spine. So when we look at the lower back, there's this curve in the lower back. Now, invariably, it's fairly common that somebody has either too much arch or too little arch, and the spine becomes very straight. So we want there to be a balanced architecture in the lower back, and what that does is helps to take the pressure off the lower back and keeps things more centered. Remember, gravity moves in one direction, which is straight down. Because it moves down, there's compressive force, and low back disability is the number one cause of disability in the world. Because it's so prone to having problems. There are more people having low back problems than just about any problem on the face of the planet. We want to take care of our low back. And to the degree that you can keep both the alignment, meaning how straight the body is, and the architecture of the spine in the most upright position, you're going to do better over the course of your life. Now, there's other factors to low back pain, such as what we call the core, right? So our core muscles come around our 360 degrees all the way around the center of the body, really from about here all the way down to mid-thigh, this whole section in here. And so if the muscles are weak, if your core is weak, if you're not holding your body in a good position, then there can be a breakdown in the spine, in the discs, in the connective tissue, and all the parts of the lower back. So as a chiropractor, we look at several things. We look at the posture of the individual. We look at the alignment of the lower back, how straight or tilted the lower back is. If there's twisting in the lower back, you have to get that out of there. To see how a person is using their body in the course of their day, whether maybe they don't have good posture, or they're sitting in front of a computer all day and they're slouching at their seat. These things can cause more stress on the lower back than we really want to have there. Now, if you're doing certain exercises and activities that can have a tendency to jar the lower back, such as, say, like running. Running is this repetitive movement that affects the lower back and causes all sorts of compression in the lower back. Well, again, when the spine is straight, it's going to absorb that stress much better. But what can happen is, because of that repetitive action of the movement, it can cause the pelvis to become twisted. So, again, the treatment of low back related problems are pretty straightforward if you know what you're doing. But the point is to allow for good tension in the muscles and good tension in the ligaments, and the alignment being in a good place, and the architecture having a nice shape, and to preserve the discs, right? So between the bones and the spine, we have discs. You can't see it here. You can see it a little bit over here, where there's a disc in between each of the bones. It's one of the things that allows the body to be able to move and bend. So, the disc is made out of cartilage, and so cartilage is prone to wearing down. It can start to, if the body is tilted or twisted in some way, sometimes it's not just tilted this way, it's also rotated as well, then it's going to cause an uneven wear on that disc and cause the disc to potentially to wear down. So every situation is a little bit different. And people who have been in auto accidents or had sports injuries, or they sit for lots of hours, or they're standing with poor shoes on concrete ground, matters. And what you do in your day-to-day matters in terms of how you're taking care of your back. Certainly if you're lifting, or you're lifting something heavy, making sure that you're bending your knees so that you're protecting your lower back. Another factor can be the flexibility and the balance of muscles in your legs. And so sometimes what I see with people who have low back pain is they have really tight hamstrings. So the hamstrings run on the back of the thigh back in here. And what happens is it gets really tight in there, and the low back is like a hinge, right? So if a person bends at the waist, they hinge here, and what that can do is, if the muscles are either tight here, or tight in the glutes, or tight in the lower back, it can start to cause the body to be pulled in one way or another. So this is kind of it's kind of an involved question, even though the treatment of it is pretty straightforward, but you still have to understand what the nature of the problem is and what you need to do about it to keep these low back problems away. Chiropractic is amazing at resolving low back conditions, and we're here to help you in any way that we can. Hope this was helpful for you. Thank you so much for watching.